Hello, everyone, and thank you for joining us today for this webinar session. Our topic for today is the global impact of COVID-19 on families, and I'm incredibly excited to be able to participate in this discussion. First, a word of introduction. My name is Dr. Rachel Vreeman. I am a pediatrician, and I'm the chair of the Department of Global Health at the Icahn School of Medicine at Mount Sinai, and I have the privilege of directing the Arnold Institute for Global Health here. My own research and work as a pediatrician has focused around the global needs of children who are growing up with HIV, particularly in sub-Saharan Africa. And whenever we have a topic that we get to discuss that really shines a spotlight on the needs of children and families, it makes me particularly happy as a pediatrician and as someone who knows all too well the challenges that so many families are currently facing. At the Arnold Institute for Global Health, we have been privileged to host this webinar series to really think together with a variety of experts from across different disciplines around the ways in which COVID-19 and the pandemic have had impacts on global health. And as I said, I'm really excited to have this discussion move forward today. So welcome to everyone, and let me introduce you to our speaker joining us today. Today, we're really privileged to have with us Nada Elattar, who is the Early Childhood Development Specialist at Unicef, with the headquarters here in New York City. She is focused on early childhood development in emergency contexts globally. She has a lot of experience with a background in education, public health, and communications, and she's led teams that develop and implement large-scale early childhood initiatives around the globe. She was formerly the Senior Director of Educational Programs in International Social Impact for the Sesame Workshop. And in addition to her roles at UNICEF and at the Sesame Workshop, Nada is currently the co-lead for the Interagency Network for Education in Emergencies Early Childhood Development Task Force. She's also the vice chair of the Early Childhood Peace Consortium, and she's worked for a number of well-known international organizations, including as a communication and research advisor for the UN's World Health Organization's the Mediterranean Center for Disaster Risk Reduction in Tunisia. While in Tunisia, she also served as an English language instructor with the America Middle East Education and Training Services, and she's worked as a writer and editor for UNICEF in Tunisia as well. Other positions include serving as a communications advisor in Cairo, Egypt with the Johns Hopkins University Center for Communications Program, as well as work with the UN's World Food Program. So she really joins us with a diversity of both academic experiences as well as incredible experience around the globe with agencies focused on health particularly. Nada has a Bachelor's of Science in Health Education from San Francisco State University and a Master's of Public Health from the Johns Hopkins University Bloomberg School of Public Health. Now, I had the opportunity to meet you, Nada, in the context of an advisory panel for the Sesame Workshop, coming together to really talk about some of the impact that COVID was having for families and especially for young children globally, and considering together from various expert perspectives and various international engagements what might be done with children around the world. And I know you have this incredible global perspective on what's being done in the context of both this pandemic emergency as well as emergency settings in multiple places. Also, of course, I feel like for parents and families, both here in the United States and also those we've talked about all over, an issue that has been very much at the forefront of everyone's minds has been the challenge of education right now, and talking about remote learning, educational options, balancing potential returns to school, whether that looks like in person, hybrid models, remotely, various forms of remote education education. And with all of that, and on a day when here in New York City, where we are, schools are just returning in a new stage today as well. I think there's so much we could talk about related to the context of remote learning for really young children, especially. So and thinking about your work at Unicef, just as a framing for our discussion as well, I really appreciated the report that you put forward related to the issues for remote learning for the world's children and what that looks like, and particularly to consider the incredible fact that for an estimated 463 million children worldwide, or about 30% of the children around the globe, they don't have options for, or sustainable options really, for remote learning at this time. So I want to talk about all of that. I know that's a lot to go through, but I guess let's start, if you are willing, Nada, with talking to us and our audience from the start about why early childhood education, and especially this window of early childhood as we consider it, is so critical.
Thank you so much, Rachel and colleagues, for having me. I appreciate being part of this discussion. To answer your first question, Rachel, we know that the first 1,000 years of life, 1,000 days, excuse me, are critical, and they're a critical window of opportunity for brain development, for a lot of the foundational development that is needed for later term and long-term success in life in the various aspects of life: education, socioeconomic opportunities, etc. When we think about COVID-19 and the disruption in everything from childcare to, because childcare is critical for younger children, it's critical. It's an opportunity for them to be playing. Play is a very important opportunity for growth and learning and socio-emotional development. Something that we don't always think of. And then, of course, pre-primary, primary education are foundational steps and foundational opportunities that children have to learn. I will probably talk more about learning than education,
Sure.
because I think it's much broader in scope, and so much learning happens. But in terms of the impact that this pandemic is having, we can look at middle income and higher income countries, and there are certainly lots of disruptions and issues happening there. But when we look at refugee context, for example, and contexts where it's already very difficult to provide basic education, basic learning services, what's happening with the pandemic is it's making it even more difficult, making it even harder, and resource mobilization to support programs. A lot of resources that were maybe potentially going for education, et cetera, are being or have been rediverted to support sort of the immediate acute response for COVID-19. So it's kind of this plethora of impact that really this wide range of things that are impacting children's access to services, everything from childcare. Childcare supports parents who can then go to work because their children are well cared for, or at least they have some form of safe childcare care. Childcare has been the number one, within the COVID response, it has been the number one service that has been disrupted in everything that we are tracking as Unicef. Of course, education is tremendously impacted, but all childcare and all of these different elements have ripple effects that we can talk about for a very long time.
Mm-hmm.
I hope that answers your question. I can dig a little bit deeper in some of the next questions.
Well, I know, yeah, and I know it was a big, broad one to start with in that way, and there's so much we could dig into that way. Could you maybe paint a little more of a picture for us about the ways in which family life has been disrupted in different parts of the world, and maybe especially how that impacts young children in those families as well, kind of what that varies, like whether it's in refugee settings as you were saying, or in some other examples of what you've seen as you know, talk to partners in your offices across the world?
Sure. Thank you, Rachel, for that question. In terms of COVID-19 and its impact, I mean, one of the biggest impacts it's had has been on job security,
Mm.
you know, jobs for people who don't have the I would say luxury that we have to work from home or to work remotely or to have a proper and safe social distancing measures. A lot of people had either been forced out of work completely
Mhm.
or continued work in unsafe environments and therefore exposing themselves and their families to other forms of adversity and potential, contracting COVID, et cetera.
Sure.
So I would say job insecurity, when we think about parents, that is kind of the one of the key foundational elements that have been disrupted. And that has also an impact on their ability to provide, school fees for their children, et cetera. I think there is sometimes an assumption that schools, all over the world, even in poor settings, et cetera, are provided for free by governments, et cetera. When it comes to young children, pre-primary, kindergarten, daycare, all of that, it's very much private as it even had been in New York up until more recent.
Mhm.
So when you have sort of a situation where parents are not working and services are also closed down or disrupted, the already limited services are closed down and disrupted, what you create is an environment where children that perhaps going to school or going to a pre-K was their one form of or one opportunity to play with other children, and now they don't have that opportunity. It may be their one opportunity to actually be learning, and in many contexts we have parents who really rely on the system to teach their children and to provide the basics where the parents themselves may not have higher educations, may be illiterate in many cases, and so that one outlet that they have is sort of disrupted. So, and you can think about it in this way, that one month, 2 months, 3 months, 6 months of this type of disruption has a cumulative effect on children's ability to then catch up later on, when things and if things go back to what they were before, which we're not sure they will. Will they be able to catch up? 6 months for a 3, 4, 5-year-old child is a tremendous amount of time with the potential to develop a great deal in many aspects or
Yeah.
to fall behind in many aspects.
Sure.
So, and then, kind of thinking about your question from a broader social,
Mhm.
thinking about it from kind of the social perspective, what we've seen are spikes in violence against women, violence against children, including children with disabilities and young children who tend to be more vulnerable to these types of things,
Mhm.
because people are spending more time at home, spending more time in environments where that may not be safe for everybody, and the outlet that they may have had, to get out, to come back, et cetera, has also been disrupted. So we are seeing spikes in that, and it's quite significant. It is of concern for sure. And then, just to kind of give an umbrella, I should have said this in the beginning, but we are looking at all of this as kind of a crisis of care and learning.
Mm.
Um, I want to be optimistic, and I do have, I think we are optimistic about the future, but we have to look at this as really a crisis of care and learning, both very much closely connected to each other.
Sure. Sure. And I'm really struck in what you're saying, thinking about these spikes in violence and the various factors impacting families, how there are so many things that are layering on top of each other in these situations, that you have the loss of jobs, you have the economic insecurity, then, that of course, can create physical needs in terms of not having adequate food, and maybe having your shelter be at risk in terms of, not having a stable place to stay. And then of course also, there are the physical risks of the infection, but also everything that goes along with not having enough food or safe water and those things. And then all of that creating just this intense stress on adults, especially at first and foremost, and then that creating the kind of stress in the home as well. Of course, not to mention exacerbations and mental health concerns and, not being able to access social support as well. Do you, I, certainly I recognize that there's both like a lot that's overwhelmingly negative in that, and also of course, that as parents, of young children, it's really easy to feel a lot of guilt and concern on top of all of these things as well. Do you, so maybe for a moment, but not to at all underlie, this incredible the incredible burden of this situation, but what are some ways that you could share with us that UNICEF has been trying to meet some of these needs or combat some of this incredible burden from the pandemic, especially for, early childhood and on young children and families with young children?
Sure. Thank you, Rachel. So when this pandemic first started and really kind of, I guess in March, when it really kind of expanded and impacted so many countries around the world, we quickly conducted surveys actually with parents and families, rapid assessments to get a sense of what people have a need for. And what we heard from the vast majority of parents is, we don't want you to tell us what to do, like just in general, on how to parent, etc. That was something that was very solidly came from many parents around the globe. What they said is they really need, now that schools are disrupted, childcare spaces are disrupted, they need real practical tools, guidance, content, digitally through radio or whatever format is appropriate for a particular context, to engage their children at home, to engage with their children at home. And that actually spanned across refugee settings. It spanned across so many different contexts where parents really had a demand for that. So what we did as a global response, what we did is we worked with many partners. We worked with many of our regional and country offices to collect and collate all the resources that we already had digitally available, as well as materials that were potentially safe, hard copies of content that could be distributed safely. And we essentially had a dissemination plan and a hub where country offices and partners could access those resources in multiple languages and utilize them and send them to families through WhatsApp groups. So I'll give an example. In Jordan, we have these centers called Makani centers. Makani in Arabic means my space or my place. And they're centers where actually parents come, teenagers come, as well as young children. And there's a range of services that are provided, everything from ECE, early childhood education, to parenting programs, to mental health and psychosocial support. Now, given Jordan was a country that shut down its borders and shut down its programs relatively early in the process, there was no way of reaching these parents. The country teams developed WhatsApp groups. They had parents' phone numbers, the parents who come for the services, and they're a combination of low resource Jordanians as well as Syrian refugees. So I would say the people most in need in that country. And through those WhatsApp groups, they actually distributed information. There was a lot of chatting back and forth between parents. These WhatsApp groups were facilitated by a professional ECD specialist or a parenting specialist who was able to kind of answer questions, respond to people, send resources that were needed. And they also developed a series of videos that were essentially demonstrations of activities that parents could engage their young children with at home. So their parents' concern was really, now that you can't provide these services in a center, what can I do at home? And I would say we heard that across the board from so many different countries and so many different contexts. In other countries where there weren't radio programs, we initiated radio programs. Any kind of remote access was, I would say, enhanced during this period. It was really an opportunity for us. And I would say not just UNICEF, I would say for the entire sector, really. I think COVID-19 shook everybody to really rethink how we program and whether or not the way we normally program is really the most efficient, etc. Now, with all this said, there are communities where there isn't access to WhatsApp groups, and there isn't access to particular technologies, etc. And I think those are the communities where we have to concentrate more efforts and think through, if we are to have a situation like this again. It's ongoing, so we'll see what happens in the next months or year. How do we reach people safely? How can we make sure that people are safe from COVID-19, but also receiving the services that are needed to prevent other unintended consequences of this, one of which is a mental health, I would say, crisis that is impacting people all over the world.
Sure, absolutely. I think it's so interesting to hear about the use of the WhatsApp groups for those purposes in that way. It's where a lot of my work takes place in Kenya. We've increasingly leveraged the use of WhatsApp groups among adolescents who are living with HIV, both for peer support and also to deliver some mental health support services. And we continue to explore how we can use that similarly to get out, educational messages, public health messages, thinking about as things are changing, of course, with the recent pandemic, but also then thinking, how can we leverage that for teaching more about, say, preventing HIV or education. Sorry about this. I have like a moving thing there. And, yet at the same time, I'm really struck, of course, by how, it of course then brings up the gaps in that kind of access and what we can do in places where even something like WhatsApp, which is, relatively, used across really a broad context globally, where those kinds of services are not accessible for families as well. And, in saying that too, I was really struck by a recent article that the New York Times had that was really digging into some of the issues related to, in the United States, even how, because we have not invested in, more national access to Wi-Fi, for example, how many families were again being disproportionately cut off from some of the remote learning options because they didn't have internet access or couldn't pay for the kind of data access that would be required to do it on phones, or even families being told then to essentially have the children try to operate out of places near the school in the parking lot or things like that to be able to access Wi-Fi. But so I think it is it's a way in which both we can consider how to advocate for children broadly, that even, where there are specific gaps in resources and in places, and also how might we, learn better from the global lessons, that your country programs are so, effectively rolling out in different ways, how to best bring resources to families along those lines. I would love to have you tell us a little bit more about some of the methods of remote learning. I certainly appreciate the idea that families globally say, we don't want you to tell us how to parent in this way, but we really do want access to resources in this way. And thinking about how many places might be relying on radio related programming for things like that, and what that might look like. I wondered if you could talk a little bit about perhaps what you've figured out can be done through radio as a media option, what you're seeing maybe working in terms of supporting early childhood learning through, other types of media, whether it's virtual or the WhatsApp groups, and I guess any, compelling lessons we could learn from that, especially as we think about what children and what families need right now.
Sure. Thank you so much, Rachel. I'll start off by saying that for different contexts, different things work, of course. So I think, if we're to really implement anything properly, we have to do targeted needs assessments. We have to really understand the communities that we're working in. We have to ensure that the communities are part of the process of weighing in. They're part of the process of developing a program, whether it's a radio program or a TV program or other, and that they're very heavily engaged and involved, if not leading it, and we support from a technical perspective or from another perspective. I would say, having worked in the media industry for quite some time, the children's media industry, a lot of the children's and parenting radio, especially children's radio programming, TV programming, other forms of always been intended to be supplements to whatever other kind of learning and education is happening in a child's life. So, if we're talking about, I feel I can talk a little bit about Sesame Workshop because
Sure,
I've worked with them for a long time, and we're currently in partnership with them as well. So Sesame Street was essentially in many ways a complement or a supplement to children's learning, in school, where they may not have had the best, they may not have been part of the best systems or what have you. So this was intended to be a supplement. For radio programming as well, that Unicef implements and other partners implement, it's intended to be an opportunity for the transfer of like oral tradition, or focusing on particular socio-emotional lessons that you can kind of present or represent through radio, etc. But as a sort of core method for teaching children, of course there are organizations that have created kind of online curricula, high-tech online curricula that go from the beginning of a school year to the end, etc. But that is really, to your point, it's really not been implemented in areas where there are the greatest needs. These are areas that have higher access to technology. I can't remember the names of the programs now, but I know that in Japan and parts of China, there are such curricula that have been developed that really take children from like grade 1 to 3, mostly online. They can learn a lot through that. But in the context that we're talking about, we're talking about, already very limited access to education, already very limited access to play and learning opportunities that again are being exacerbated by this. So I think it's really important for us to think about technology, think about it from an access perspective, seeing how we can potentially make it more equitable. But I think before we do that, I think it's really important to understand how effective it is and how impactful it is for young children. And I think I feel quite comfortable saying that we don't know yet, and that is what we're trying to do in these next years, through the COVID response, to understand, is this an area that we should really invest more in and be more equitable because it has an impact, or should we really focus on getting kids back into the centers, getting kids back into the schools, and continuing to look at these as supplements? Because I don't think we should invest very heavily without really understanding how effective they are. We know that these technology can be effective for older children. We still don't know how impactful it really can be for younger children on a scale and sort of on a global level that we're talking about.
Sure, absolutely. And I think this of course really ties into what you were saying earlier as well, in terms of the incredible need for socialization and for play as parts of the learning process for young children, particularly in this. And that we really can't we really can't position, even maybe the very best of technological options that way as substitutes for what happens in terms of that, of those processes of socialization and of having play and interacting in that way. Along those lines, what either, I guess kind of what is UNICEF recommending, or what have you seen working, or what might you say related to our thoughts about how we can help, safely meet children's needs for socialization, especially in this critical, really early childhood window, and how might we especially do that for children who have the greatest needs, perhaps those, most at risk of violence, or in the, least stable living situations, or, things along those lines, where we really see these tremendous risks that we're trying to balance at the same time as considering their risks for the pandemic spread as well.
Yeah. Thank you, Rachel. It's a tough question.
Yeah.
I can answer it in so many ways.
Sure.
The reality is that no matter what kind of guidance we put out, even whatever guidance governments put out, there are limitations in certain countries and certain contexts to how much we can actually stop children and adults from interacting with each other.
Sure.
Some of it's cultural, some of it is it's just not feasible. So what I have been seeing is that there are, and also it varies depending on socioeconomic level within a country, or socioeconomic strata within a country. So what we're seeing is, when it comes to some of the higher socioeconomic strata, people have the opportunity and are able to sort of keep proper social distancing measures. Many schools around the world are reopened, but they have adequate or some form of social distancing measures, face masks, shields, etc. Testing for COVID-19, etc. But that is something that is not really feasible in many contexts that we work in. I think we do have to be careful about balancing, how balancing protecting children, parents, the community from COVID-19 with sort of the overall well-being of young children and parents. So I would say, it's a tough one, because again, depending on what country, where, et cetera, I can answer it in so many different ways. But
Sure.
I'd say for all contexts, we have to sort of be conscious of this, and in some way we have to start, unless it's like an epicenter of the outbreak, et cetera. I think we do have to start sort of testing waters, opening things slowly, having kids start to engage with their peers, to talk about hygiene, to reinforce things that we should be talking about in all cases. Hygiene is extremely important for so many reasons. In so many countries, hygiene is important for nutrition intake, keeping yourself and your system healthy so that you can absorb the nutrients that you're eating, et cetera. So these are all really they're learning opportunities. And I see COVID-19 as it is a crisis. It's a global pandemic. It's a pandemic. It's a global crisis, but it's also really an opportunity to reassess, to reinforce the things that really need more support. And I would say that there are a lot of lessons that even very young kids can learn from this as we move forward. I hope that answers your question, Rachel.
I mean, there's definitely no easy way to answer that question. I guess I didn't expect that. I mean, I wish in many ways we could wave a magic wand in this in this sense and bring about something different that way. And I'm struck. There are a lot of different ways I could go from there as well. But struck really in what you say too. I think about. I guess especially considering how there there are populations of kids and places where having gaps in their education in the ways that they might be seeing, or having countries just sort of some countries have sort of almost like thrown out a certain part of the school year and say like, oh, like we're just going to not count that part of the year, or we're just kind of starting over with this. And um, I think for kids with more resources, as well as, a broader access to education, they can be, in fact, as we often say, like incredibly resilient. They can catch up as long as their basic needs are being met. But it really is those kids for whom there are already they're already facing inequities and vulnerabilities on a number of ways that I worry that we compound them when we, don't at least let them have access to whatever form of either a kind of social play area or school that we can provide, obviously wanting to do that as safely and carefully as we can, but just the critical importance of prioritizing that within a society. Of course, I do hope too that there might be lessons that we learn out of all of this in terms of the value of public health systems, contact tracing and testing, and as you were saying, having better understanding of the hygiene practices that are really so critical and that can make a real difference for many of the things that make our young kids globally sick and do lead to so much loss of life, the diarrheas and pneumonias and other things that could be prevented in the same way by hand washing that we are promoting for COVID as well in that way. I would be curious to think and kind of share with our audience ideas about innovative, resources you've seen or strategies that might particularly help families with young children during this time. I know that a lot of this could vary from one place to another, but I'd be, curious to hear more examples, perhaps, of what you've seen working and ways that perhaps individual country responses and so on have been particularly innovative and interesting and might have relevance for, even families here in the United States as well, as we consider that.
Great. Thank you so much, Rachel. I'll start off by answering that from actually, a donor perspective, actually. What we've seen, because it's very important, donors are very important to the work that we all do. Funding is extremely important. What we saw in the beginning stages of COVID and even now is, extreme empathy and extreme flexibility from various funders and donors to redivert resources or actually provide surge funding, immediate surge funding to, and also unrestricted funding to really help organizations and countries, et cetera, respond in a way that they feel is appropriate. So, and I think we saw a lot of, I don't know how innovative the financing was in that sense, but a lot of organizations that generally don't provide funding for emergency response jumped in and provided funding for emergency response. Some very specific to early childhood and young children, knowing that oftentimes, young children are, young children's holistic development is not always focused on, especially in the acute phases of a crisis.
Sure.
So, and I mean, I could name so many, but I'll refrain from that so I don't leave anybody out. But it's definitely an important critical first step because it allows organizations to be innovative. It allows organizations to have resources to be able to respond. because this crisis really did add on. It's not like there are resources just sitting around waiting to be used.
Right.
There was a need for that additional support. So in terms of innovative ways to engage parents and to respond to parents, besides the WhatsApp groups, which is not a very high tech type of way of engaging, I mentioned earlier, radio programs started to focus more on the learning, the less on the socio-emotional kind of lessons, and more on the basic, learning that children may have been getting in schools. So full curricula were kind of incorporated into radio and sometimes television programs, depending on the context. There were also a number of parenting apps. The efficacy and how effective they are is still to be determined, but parenting apps in appropriate context, especially around Latin America, Eastern Europe, and some very low resource settings, but settings that have access to technology, have good access to technology. So I would say we were kind of tracking those and tracing them, and some of them are time questions, allows them to get resources in real time. And I would say it's not very innovative, but it has definitely, the need for this kind of outreach has been, I would say, definitely brought to the surface. I think in terms of, do you want me to just talk about what we see from partners as well?
Yeah, sure, absolutely. Yeah, I think that'd be.
Yeah, so we saw, a lot of partners kind of take, Sesame is one of them, Save the Children is another partner, and many others who have we all actually took kind of a moment to reflect, a very quick moment to reflect on, how can we, reach people more innovatively, et cetera. I know that Sesame created an entire curriculum, multimedia resources to address parents globally in, I believe, 26 languages. So really we saw this boom in content development to reach parents and young children through technologies that are accessible to them. Now, we're lucky in today's world, we're quite lucky to say that the majority of people have access to radio and or television. So if you kind of know your audience and know how to reach them, you can tap into those mechanisms to reach people. And just like we've adapted to kind of Zoom meetings and all of this, people are adapting and trying to be flexible to access these types of things and get access to them. Now, your point about sort of the gap in terms of access to technology, et cetera, is a very important one. And my hope is that we can see this as a lesson to say that some of these technologies are actually basic things that we should be providing to internet, access to internet in a crisis setting. Yeah. Ideally, you want to be able to reach everybody in your country with a message at a given time. It's the same as like the emergency broadcast system or some mechanism for reaching people on a mass level, and not just relying on whether or not people have a phone, like making that communication really accessible to everybody. That I think we're yet to see on kind of a global level, but at least on a country level, it needs to be, I would say it should be focused on more and more,
Sure.
especially in these contexts. Yeah.
Yeah, I think that's a great point. I want to, before I ask another question and sort of starting to think about kind of your recommendations for the future and what you would do if you had a magic policy wand you could wave over things in that way. Let me just mention to the group who's tuning in with us that we would love to have you submit some questions. So as we're talking for a few more minutes, then I'll turn to trying to answer ask and answer some of your questions. So please feel free to type questions into the chat box. or the Q&A box that you should see at the bottom of the Zoom screen there, and we'll work our way through some of those as we go here. So I would be curious, I think it's incredibly great point that you make, Nada, related to the need for at least national communication strategies and access to some form of technology in that way that would make such communications and things possible. I would love to hear from your perspective, and especially from your your immersion and leadership within global policy and networking groups such as Unicef. What changes you would love to see advocated for at a global level and happening at national levels to really improve the status of our early childhood development in times of emergency and pandemic, especially. But what kinds of long-term changes could we make that would really bring about improvements in times like these?
Thanks so much, Rachel, for that question. As you know, policy is a very big part of what Unicef does, and working with countries and different organizations on it. I would start more broadly by saying that we do, because we focus on early childhood and early childhood education and development, we have to ensure and work towards having universal, I say universal meaning global, ECD policies. They could be at a national level, but we do need to ensure that all countries have an ECD policy and a plan, and that plan is actually being implemented. Right now, UNICEF is working towards that. We track how many countries actually have a policy or plan, and those do not. And we work with governments on ensuring that there are a set of policies in place to support young children and families. So that's kind of on a very broad level. I'll go in a little bit more narrow and focus on what we call family-friendly policies at UNICEF, and it's something that we initiated a few years ago and are really pushing forward very strongly. So family-friendly policies, it's not just restricted to early childhood, but it's very much focused on early childhood.
Sure.
And our family-friendly policies include kind of 4 key components. One is access to childcare, so ensuring that families and working mothers and fathers have access to adequate, safe childcare services. And we have so many great examples of employers, private and public employers around the world who are actually providing childcare for their employees, which in turn leads to, higher yield for the organization and better satisfaction from the employees with the company or organization that they're working with. So it has only benefits really to provide to bring if an organization is willing to put the resources into that. And there's so many benefits. I won't go into all of them. Child grants is another part of family-friendly policies. So ensuring that families who need it have access to child grants, so additional support for their children's nutrition. Paid parental leave. I'm talking about both the formal and informal sectors. This is something that we are promoting. So paid parental leave, some form of compensation reimbursement for parents who are going on break when they have a young child. And of course, for the formal sector, it's a lot easier to engage, but we are working towards that and making some gains in that area. We have examples of tea plantations where child care centers have been built just next to the tea plantations, so that mothers can go, they can go work in the fields, come back, breastfeed their children, and their child is next to them in a safe space. It allows for economic opportunities for women and has so many other benefits also for the child to be close to their mom, especially at a very young age. And then paid breastfeeding breaks as well is part of the family-friendly policies, ensuring that, you know, mothers who are breastfeeding or pumping, et cetera, have access to a space where they can do that, and they're not being penalized in any way for it, that they are being paid for that period of time. So I would say, and you can find more information about the family-friendly policies on UNICEF's website. It's applicable pre-COVID, post-COVID, I would say even more important. But yeah, and we have a series of guidelines as well specific to COVID-19 on how employers and governments can support parents during this pandemic. It's focused on the family-friendly policies. I'm happy to share that as well.
Yeah, I love that. And I think that would be a terrific link to share with people. You know, I do really hope as we spotlight this issue and, you know, with the privilege of hearing from you today, that it helps us to, even as individuals and individual families, you know, wrestling with our specific challenges, to continue to, you know, think a bit more broadly and consider, okay, how can we advocate not just for our own family, but for what really is needed in our communities, in our countries, and even globally to support families and these critical issues of childcare, of support for breastfeeding, of parental leave, and so on. Really, absolutely echo that, and are of course, as you said, relevant suggestions, no matter, you know, what we're thinking of, pandemic, non-pandemic, wherever we are in the midst of that. I'd love to turn attention to some of the questions that we've gotten, and then maybe we'll, at the end of the hour, I'll give you a chance to kind of wrap up with any final thoughts. One that's here asks, you know, what are some of the consequences of decreased socialization for children, and what can parents or guardians safely do to try to maintain or improve socialization for their children?
Great, thank you. Thank you for that question. So the consequences of decreased socialization, especially over a prolonged period of time, I mean, you know, for younger children, I would say it matters much more than it does maybe for adults, you know, et cetera. Although, you know, what children learn from playing with each other, you know, are things that may not be, you know, very obvious. Some of them may be obvious, but, you know, they learn to share, they learn to take turns, they learn to even fight and argue and get over it and engage and resolve conflict, etc. There's so much learning that's happening through those social engagements, plus joy, you know, just the joy that they have with interacting with each other, etc. And, you know, I think for a short period of time, you know, it's relatively okay, but for a prolonged period of time, basically we're losing all those learning opportunities are being lost. Frustration, children, if they're not able to play and, you know, explore, etc., may act out, may get frustrated, which is completely understandable. I think, you know, things that parents can do to engage is to combat this, essentially, is to see if there are opportunities for play, you know, for socialization. I say the word play a lot because for young children, socialization is, play is their form of socialization in many contexts. You know, to basically engage in games and play that is non-contact, you know, soccer games, other forms of sports where they don't have to be very close to each other. You know, where technology is accessible, they can socialize through that, although what we've seen is, you know, it's not as satisfying for kids, and I think for adults as well, to really engage and socialize in that way. So, so I would say to find the opportunities where they can actually do it in person. And then I think this is also an opportunity, what we've seen in some of our tracking is that this is an opportunity for families for some families to be closer, for some siblings to be closer, or, you know, cousin, or, you know, larger family groups to be closer and more engaged. It's also an opportunity for parents to play more and socialize more with their own children, which is something I think that is something we need to work on as a global culture, that play with your children is extremely important for building a bond between you and them. It's also important for their socialization, and in many cases, parents are their children's role model, and so they're looking at that and emulating that in their own social interactions with their peers. So I hope that answers your question. I think, yeah, it's a difficult question for me as well, because I think there are a lot of good resources out there as well that can provide exact activities that parents can do with their parents. And those Lego Foundation, Sesame Workshop, and many others have developed them on their websites that can help as well.
Yeah, and we can absolutely include some of the links to sharing those resources once we post the recording of this session as well. So as a note for anyone who's interested, we typically do put these sessions on YouTube, and we can include some of those resources and links that you can follow up with as well if you're looking for specific resources that way. There's another question about children with special needs, particularly children with special needs like ADHD. Of course, there are various both learning needs and developmental special needs that children may be experiencing, and pointing out that especially as parents are trying to balance these, I think, impossible choices between health and life and education and paychecks, and and maybe especially the critical role of that for children with special needs. I guess along those lines, not that we expect you to have a particular solution, but is there anything you can think of to share about how families of children with special needs in particular might be supported, or things, and as well as, policies we can advocate for related to children with special needs as well?
So I'm really glad that this question came up, and I'll answer it in this way, in saying that this crisis also brought to light or brought to the surface really the disparity between, the disparity in terms of provision of services, et cetera. In Unicef, we say children with disabilities or developmental delays or other forms of delays. So we do use that word. I think there are different organizations that use different terminology. Sure. So it has created that, and that it has brought to surface that gap, and that there is a huge gap in terms of the provision of services, especially during COVID-19, for, again, parents who may not have the access they had before to support, et cetera. I know that our disabilities team, in coordination with the early child development team and others, are working on very specific guidelines. It's at an interagency level, so it takes time to work across various organizations. I think there are about 20 organizations involved, but they should be launching quite soon guidelines for parents on activities they can engage with their children in, and they go through a range of types of developmental delays, learning disabilities, etc. I wish I could share those now, but I know it's still under development. But I'm really glad this came up, because it's an area that prior to COVID and exacerbated by COVID is an area that is really underreported, underrepresented. I would even say underfunded at a global level. And when you multiply it by disaster and other contexts that people are living in, it's really a critical need. In terms of policies, I'll be happy to share some links that we have on our Unicef site. I'll share all these resources policies that are specific. We did develop a few things that are COVID-19 specific.
That would be great. And yeah, I definitely want to acknowledge as well, like just thinking about families, across the world who are, struggling with this particular challenge. I know I've heard this from a number of families, just as individuals, that when you have a child with a developmental delay or disability, the balance that that you're trying to reach between one set of risks versus another, when you consider what it means to be away from services or therapies or school or other forms of social support and so on for your family, it of course dramatically changes the picture for your family and for what you might need and where your risks are that way. So it really certainly I think that's an enormous challenge, and even if we don't have I wish we could fix things more quickly than we can, of course, but at least please do know too in that way that this is really something very much on the hearts and minds of people advocating and working towards better child health as we consider this as well. In our last moments together, Nada, first I want to very much thank you so much for spending this time with us and for having this conversation with me today. I really appreciate you taking the time in the midst of the work and sharing more about Unicef's involvement and about the picture that you're seeing for families globally as well. I wondered if you could share, as as sort of a wrap up, as you think about the future, and especially consider the future for children and families as we look, down the road as this pandemic evolves, but also as you consider the needs of children around the globe. What gives you hope, and what do you hope or envision that might lead to creating a better future for our children globally?
Thanks, Rachel. To be really honest, I mean, children themselves give me hope. I mean, they really do. In the most, what we might consider the most dire of circumstances, you see laughter, you see play. It doesn't take that many resources. Really, I don't feel like it takes that much in terms of physical materials and resources to really stimulate, engage young children. I think what motivates me in this space, I think about early childhood development from a public health perspective. I think about upstream interventions. I think about going to the root of an issue and addressing it there. And children are, they are forming and they're developing from, when they're born to when they're older. And to me, I look at that as an opportunity really to influence, whether it's from a policy perspective or, being a teacher working directly with children or what have you. What motivates me is knowing that we are working, at the core root of an issue. That if we do that, we have less things to think about later on in life. So I very much think about things from a life course perspective, think about this as an upstream intervention. Early childhood activities and programming is really, I think if we focus on those as a society and as a globe, we of change in the decades to come. But I think we have to really make that effort and keep it going. So what motivates me is that hope that we can get more people involved in that sector, and children themselves really give me a tremendous amount of hope. And they are, I mean, it's so cliche, but they are really our future. So investing in them is extremely, extremely important and critical. Thank you.
Thank you. And again, thank you so much for this time together today. I want to thank everyone who's joined us, and to let you know, as we enter October. It is both Global Cancer Awareness Month and specifically Breast Cancer Awareness Month we look at in October. And our webinar for the Arnold Institute for the next month is going to be centered around global breast cancer and COVID. And we hope that people will join us for that as that moves forward. Again, thank you so much. Thank you to Nada Elattar for her time today and for the work with Unicef that you're doing. And a recording of this will be posted on YouTube. It usually is up within about 24 hours, and we'll include some links for you with the resources we talked about today. Thank you so much.
Thank you, Rachel. Thank you.
Thanks.